Polyvagal theory is a concept proposed by Dr. Stephen Porges, which describes the relationship between the vagus nerve and stress. The vagus nerve is the longest cranial nerve in the body and plays a vital role in regulating various bodily functions, including heart rate, digestion, and breathing. According to polyvagal theory, the vagus nerve is involved in a hierarchical response system that helps regulate our responses to stress and social engagement. This theory suggests that the vagus nerve has two primary branches, each associated with different behavioral and physiological states. Social engagement system. The first branch of the vagus nerve is responsible for promoting social engagement and connection. When this branch is activated, it helps create a sense of safety and relaxation, allowing us to engage in social interactions and connect with others. This state is associated with feelings of calmness, trust, and well-being. Fight or flight response. The second branch of the vagus nerve is associated with the fight or flight response, which is activated during moments of perceived threat or danger. When this branch is activated, it prepares the body for action by increasing heart rate, blood pressure, and stress hormone release. This response is essential for survival in acute danger. Polyvagal theory suggests that during stressful or threatening situations, the body engages the fight or flight response as a primary defense mechanism. However, if the perceived threat persists or becomes overwhelming, the body may activate a third branch of the vagus nerve, shutdown response. The third branch of the vagus nerve is associated with a shutdown response, also known as the freeze or immobilization response. This response is seen in situations where an individual feels helpless or overwhelmed by the threat. It involves a reduction in heart rate, blood pressure, and metabolic activity, which can lead to feelings of dissociation, numbness, or fainting. The activation of the social engagement system helps to down-regulate the fight or flight and shutdown responses, allowing the body to return to a state of calm and connection. However, chronic or severe stress can disrupt this regulatory process, leading to prolonged activation of the fight or flight or shutdown responses and impairing the ability to engage socially and feel safe. Understanding the relationship between the vagus nerve and stress can have implications for various fields, including psychology, psychiatry, and trauma therapy. Techniques such as deep breathing exercises, mindfulness practices, and social support can help activate the social engagement system and promote relaxation and well-being by positively influencing the functioning of the vagus nerve.